Wash your hands after you've left the patient's room. The appearance and composition of stool are important indications of whether or not the digestive system is functioning properly. Changes in bowel habits may also be an indication of illness or disease. For example, the incidence of colon cancer has been increasing in both men and women in our American society. The American Cancer Society has developed a fact sheet on the current warning signs and risk factors of colon cancer. They include a change in the character, consistency, frequency, or color of stool, a positive test for occult or hidden blood in the stool. Patients are at higher risk that consume a high-fat, low-fiber diet. Be alert to a family history of colon cancer. Patients that are 40 years age or older are at a higher risk of development of colon cancer. Patients who have a history of polyps, colitis, or Crohn's disease also are more susceptible to colon cancer. Also, a warning sign is rectal bleeding. You should report the following changes to the nurse. Any change in the color of stool. The color of stool can change when certain drugs or vitamins are taken. For example, drugs that contain iron give stool a black appearance. Also, vegetables such as beets can make the stool turn red. The presence of blood is also something that needs to be reported to the nurse. Blood in the stool should always be reported immediately. Save the specimen for the nurse to observe. Also report the presence of large amounts of undigested food or mucus that you see in the stool. And report a change in bowel habits. Normal frequency of bowel elimination varies from person to person. So report changes such as increasing or decreasing frequency of bowel elimination from normal, as it may signal an underlying health problem. Also report any reports of the patients experiencing pain related to bowel elimination, any constipation, diarrhea, or flatus that you observe, and finally, any unusual odor. This last section will discuss some information about ostomies. For a variety of reasons, whether it's due to cancer, trauma could be something like a gunshot wound to the abdomen, or a person that may have bowel disease, a person might have a portion of the intestine removed. The remaining part of the intestine is brought onto the abdomen, and an artificial opening called a stoma is made. Stool now passes onto the abdomen through this stoma as opposed to through the rectum and anus. There are two types of procedures which are done. The first is called a colostomy. In a colostomy, a portion of the large colon or large intestine is removed. The second type is called an ileostomy. An ileostomy is when a portion of the small intestine, called the ileum, is removed. In both instances, the waste material is then expelled through the stoma and into a disposable plastic bag, more commonly referred to as an appliance. This appliance is placed over the stoma. The waste material that comes out of the stoma and into the appliance can be liquid, it might be semi-formed, it might be solid. It all depends on how much of the person's intestine remains for absorption of water into the bloodstream. The patient is susceptible to skin irritation around this stoma site. So excellent skin care measures are required with any patient that has an ostomy. There are special procedures in caring for a person with an ostomy, and these procedures may be taught to you in an advanced nursing assistant or other training program. Bowel elimination, as we've said, is a personal matter. However, it is a normal part of life. Providing respectful, dignified care will make bowel elimination just a little bit more comfortable.